I still have two more questions relating to profession, works, and but I have plenty of other questions relating to you as a person, and I'm more interested in that. So please maybe brief and summarize the following two questions so that we can move to your personal life part, okay?
Okay.
So, the next question is relating to the training of psychotherapist or counselor. Actually, in China, is current in the transition from an old certification standard of clinical practitioner to a new certification standard. So do you have any suggestion for the training for psychological practitioner in China, especially psychotherapist and counselor? Regarding to your experience, what is the challenge in that psychodynamic psychotherapy training may encounter, as well as TFP, and what recommendation you would like to give?
It's difficult for me to talk except in very general terms because I don't know the concrete situation in China at this point. I have no idea about the training requirements. So I necessarily have to remain at a very general level. Are we talking about training requirements for psychiatric social workers or psychologists or psychiatrists or general medical practitioners? Whom do you have in mind?
I think most psychotherapists and counselor.
Most psychotherapists are
And counselor.
Counselor, yeah.
Yes.
I really don't know really exactly what's the difference between a counselor and a psychotherapist. I don't think we have. I don't know whether in the United States we train counselors. Generally, psychologists with general training in psychology develop practically as counselors, but I don't know whether we have special requirements. I'm ignorant regarding this issue. Are there in China special schools for training counselors as opposed to psychologists?
Yeah, actually, the clinical workers in China now is trying to bring all these kind of training into universities. And actually, we have certifications for counselor, certifications for psychotherapist, and certifications for psychiatrists. These are all different. But now the counselor's certification has been canceled. And there is going to be new, maybe standards, but it's still in the process. It's not being open to the public. But in China, the counselor is the major worker, psychological worker in the society. Actually, we have very little, maybe psychotherapists, but we have a lot of counselors. So a lot of people, including me, who learned TFP, I don't graduated from medical university. So I just graduated from applied psychological university. So I would also want to learn TFP and psychodynamic approach. Yeah. So my question is relating to if an institution or the government want to train those people to become really capable to work with patients with no matter severe problems or some neurotic problems. Yeah. what do you think the challenge would be, and do you have any suggestion regarding to your experience of training psychological practitioners? Yes.
I think that it probably would be practical to have a basic training in clinical psychology.
Yeah.
That psychologists should select the specialty of clinical psychology and should be trained in clinical psychology, and there should be therefore bachelor degrees, master degrees, and doctorates. I think I would require a master's degree in regular psychology in order to train a psychologist as a psychotherapist. And I would divide the training into a cognitive behavioral segment and the psychodynamic segment, and teach with the master's degree systematically cognitive behavioral psychotherapy, the theory and practice, supervised practice. I think a master's degree should be sufficient to learn the techniques of cognitive and behavioral psychotherapy. I think that there should also be the possibility to become a psychodynamic psychotherapist. That would mean learning psychoanalytic theory in depth, and the technique of psychoanalysis, and have a personal psychotherapeutic experience, the duration of which could vary according to individual issues. That I would leave that very open. But I would expect some kind of personal psychotherapeutic experience together with learning of psychoanalytic theory and technique, and a practice in carrying out, to begin with, supportive psychotherapy under supervision. Supportive psychotherapy, not because it's easy, but because it offers the greatest protection against inappropriate ways of dealing with deeper layers of the mind. At a certain level of training, I would then decide that that person has a sufficient level for studying transference-focused psychotherapy or mentalization-based psychotherapy, to study supportive psychotherapy in depth, or transference-focused psychotherapy. I would think that the training would, if with sufficient intensity, would last for about 2 years. People who are interested in psychoanalysis would should enter at that point in psychoanalytic training. And I think that psychoanalytic training should train in transference-focused psychotherapy simultaneously with training in standard psychoanalysis. I'm very critical of psychoanalytic institutes who only train psychoanalysts and think that because if you're a psychoanalyst, you can do everything else anyhow. That's a big mistake. So that would be my general approach to psychology, and I would consider possibly the career as counselor as corresponding to a psychologist with a master's degree who has learned supportive psychotherapy and has simultaneously been specialized in counseling, which is very related to supportive psychotherapy. That in the case of, and I would, regarding psychiatric social workers, a psychologist would, as part of their practice, have a practice in psychiatric institutions. I assume that for a master's in psychology, you have to have some work in a psychiatric institution. For psychiatric social workers, I would expect 2 years of clinical social work practice in a psychiatric institution in which they learn at the same time to do psychodynamic psychotherapy or cognitive behavioral psychotherapy. So that could go simultaneous with their 2 years in a psychiatric institution. For general practitioners, I would, for physicians, psychosomatic experts, I would recommend that they either have psychoanalytic training or 2 years of clinical training in a psychiatric department of psychiatry, and simultaneously learn transference-focused psychotherapy. For psychiatrists, I would recommend that they study during their 4 years of residency training both cognitive behavior therapies and transference-focused psychotherapy. That's rather very general statement, but as you see, I give great weight to the basic profession, either clinical psychology to the level of master's degree. Of course, for a PhD, I would expect they would have anyhow obligatory specialized training in either cognitive behavioral or psychodynamic psychotherapy. At that point, I think total specialization is warranted. And I think that, of course, people who can do both cognitive behavior therapy and transference-focused psychotherapy, that might be ideal, but it demands a very intense training. We have few people who have that double training, and usually at the end they go into one direction or the other and find it difficult to do both things.
Okay, actually, me myself just follows the way that you have described, that I have 4 years bachelor degree on psychology, and then more than 4 years relating to CBT and supportive approach and counselors, and then 2 years psychodynamics, and then quickly I noticed TFP and can never leave my eyes from it.